Philippa. She says she's been postmenopausal, she's very exact on this, for 4 years and 9 months. She started HRT in July, 2 pumps of estradiol and 1 progesterone a day. Today she's had a bleed and a tummy ache, like period pain. Is that right? As she was expecting that not to happen because it's been so long since her last period.
It can happen when you start HRT. Up to 3 months is normal. Up to 6 months could be okay, but I do think she should see her doctor if she's had no bleeding and then all of a sudden it started out of the blue with a little bit of cramping. I think that's ringing a few alarm bells, and it definitely could be HRT. But the doctor, who's got access to her notes, will want to do a bit of a risk assessment as to what is needed for the bleeding, and also make sure it's a face-to-face appointment, because they may want to examine and broadly speaking, for unusual bleeding, unscheduled bleeding in HRT, if it's happened a little bit of time after starting, then we would normally arrange a scan, and the urgency of that scan depends on other risk factors. So there is really good guidance from the British Menopause Society that was released this year. If she wants to go armed with a little bit of knowledge about what may happen, then the Women's Health Concern have released some really straightforward points to follow about bleeding on HRT. So it's just a 2-page leaflet which you could have a look at. But yes, it's unusual to have it this 4 months or so after. I would see the doctor, and they may want to arrange a scan, or they may want to tweak her HRT, or both, but that would be for them to decide.